something else that someone prosed when assessing this data was the potential to learn more about the virus's pathogenesis, just from looking at more and more clinical outcome data, even if it's just hooked to remdesivir. Is that something we see as feasible or is happening right now?
I don't know that the remdesivir studies are going to be the answer for that. What's most interesting to me right now is probably in the area. I can't believe I'm saying this because it's not my niche by any stretch. Is anticoagulation and the procoagulant effects of the virus. And I'm very far from having knowing what to do in that area. But from some autopsy reports of patients having not just major clots, but microthrombi and things that people have suspected anyway, and more knowledge about pathophysiology in that area, I think, can help to inform things on the therapeutic side. I don't think we're just there yet. Some societies are coming up with their own guidance, but it's very preliminary on not a whole heck of a lot of data yet. But I do think we're learning. Again, the virus is 6 months old as far as we know. And if you look at it that way, we know quite a bit for that fairly short period of time. I would say we don't know we know less than we don't know. You know what I'm trying to say? There's a lot more to know.
Yeah.
But we're getting there. So I almost don't want to call it even a respiratory virus anymore. It's like a virus that spreads in a respiratory pattern and then causes effects throughout the body.
Yeah.
And we learn more with each study, I guess. Not just those that are looking specifically at therapeutics, but others that look specifically at pathophys as well.
Yeah. It is kind of hard to remember in that mindset as desperate as we are to better understand it. There certainly is a lot more understanding of it now than what was even when we last talked in April. So
even on the transmission side also, you know what I mean? Like clearly it's spread through respiratory droplets primarily, but some of the clusters that have been reported, I mean, I have to admit the choir practice, while a sad case, was pretty informative of, people in a fairly confined, but not too confined space. I think it was a gymnasium where there's room, but closed, probably is informative in how much virus is transmitted through singing. It sounds like singing is a high risk activity, through aerosolization of virus and a bunch of people who are probably pretty close to each other. These epi studies that are even done on, one cluster at a time, I think inform us quite a bit. That perhaps while I'm still going to be pretty careful with my hand sanitizer and hand washing with, surfaces, that surfaces may not be quite the culprit that we first thought they were. Still, I look at every door handle suspiciously, which has been the nature of people in infectious diseases anyway. I really don't like the term super spreader events, but some of those that have been reported show that perhaps some people are shedding far more virus than others. And again, just in the span of a few months, we're learning all these things. I think something else that shows, and this is a little off track from where we started this conversation, is that science constantly evolves and our understanding evolves. And to say at any one point we know this and be rigid as if it's not going to change is such a huge mistake. But somehow we have to transmit to the public that it is a mistake to be that way, and that it is correct to change as we learn more. So I've seen a lot of frustration over people discussing masks, do it, don't do it, they work, they don't work. It's for healthcare providers only. Wait, everyone should mask. Well, we're learning things in the interim, and also things have changed from a PPE standpoint, in availability. So as things go forward, we learn, and we have to remember to learn and, I guess, inform the public why things change and not just that they do.
I think Dr. Fauci is probably just the most respected authority that we have on the state of the virus right now, and the public health response. And we were just saying before, the tout that he put behind Remdesivir even a month ago, he had to walk back a little bit. But that's exactly what a professional does. That's what an expert does, is constantly correct even themselves in the understanding and just adapt to it and keep moving with it. And regardless how exactly those advances come, whether it's, understanding like the value of ACE inhibitors seems to help us understand exactly why children are more immune in a strange roundabout way, when most people would assume such a development would go in the opposite direction. It's exactly that, kind of conceding that like you're never exactly concise on this, and it's just going to keep adapting is something that the entire population needs to accept and kind of roll with. And yes, a little off topic from what we were talking about, but I'm glad we did touch on it, because it's hugely important right now.
Absolutely,
yeah, just absolutely understanding everything about it is going to inform every little facet of it. So on that note, if we want to just like wrap this up back with Remdesivir, Jason, where do you think we go now in research?
I think the biggest area right now is combinations. That's what I want to know. Is this a monotherapy for the mild to moderate patient? Mild meaning, I guess, moderate to severe patient, because if they're mild and they're not in the hospital, it's not going to do any good, obviously. So is this going to be the therapy for them? Is it helpful in severely ill patients if it's combined with other things? There is a moderate illness study that is being, I think, wrapped up, that Gilead had been sponsoring. So we should have that data. I think it's, I guess next month is not that far away, June. I think it can be informative as well. That was placebo controlled, so we'll learn more from that. But I think, we have to keep in mind it's our first drug. It's helpful. It's not perfect. We would love for it to be the new penicillin. It isn't, but it's a plus. And I still am glad to see this data overall, even if it's, like I said, not a home run.
Yeah, I think that was kind of a frustrating notion when this had originally happened, when the emergency authorization came with the first preliminary data, was a lot of responses hooked around the idea of, well, it's not a cure. I would know personally that if I were to be hospitalized with this, or just be at a severe state, and this is one of the options, there is something a little bit more assuring about seeing this data, and at least as a patient, even just knowing that there's something available that has shown some benefit. So
yeah, I agree. The public has to learn to not look for a cure, because I don't think we're going to find one until we have a vaccine. Yeah. That's just not what viral illnesses are.
Yeah, absolutely. I mean, you just think about all the previous epidemics we've had, and how exactly we've progressed in them. It hasn't been just an end-all be-all, and it certainly hasn't come after a few months. So seems like we're doing a good enough job right now with the research. So excited to see what else comes out of it, and hopefully have more frequent talks about it, Jason. So thank you so much for joining us right now, though.
All right, my pleasure. Be well.
You too.